The South Zona Town Hall meeting on COVID-19 vaccination in Nigeria, organized by the Presidential Steering Committee on COVID-19 in collaboration with the National Primary Healthcare Development Agency, is holding in Benin City after suffering several postponements. The aim of the stakeholders meeting is to provide answers to puzzling issues causing high hesitancy against COVID-19 vaccination, which world borders believe is the way out of the ravaging pandemic. Nigeria's Minister of Health, Dr. Usagi Ehanire, says with mortality from the virus assuming a worrisome dimension, a high national COVID-19 vaccination coverage is urgent to prevent asymptomatic infection carriers from spreading the disease.
The disease has spread with unprecedented speed around the whole world and also around Nigeria. It has taken millions of lives and afflicting global economy, the consequences of which we have not yet seen in full. Nigeria has lost over 2,000 lives, and Nigeria's GDP crashed by 23%. Other countries did much worse due to the slowdown of global economic activity occasioned by this virus.
Country representative for the World Health Organization, WHO, Dr. Walter Mulumbo, while speaking on behalf of the COVAX facilities partner, says, going by the recommendation of the WHO, Africa needs up to 274 million doses to fully vaccinate 10% of her population at the end of September, 930 million doses to meet the 40% target by December, and 1.7 billion to reach 70% of the population.
Most likely scenario is that the COVAX facility will deliver 470 million doses to Africa by end of this year. WHO welcomes the vaccine donations from the United States, the UK, Germany, and France, and contribution of manufacturers that came to the table and commit in ensuring that Nigeria continue to limit transmission of COVID-19.
The Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, notes that so far, 10,680,000 Nigerians have been vaccinated against COVID-19, out of which 1.8 million have received 2 doses. Even though that figure is commendable, Dr. Shaib says it's far below the country's target of reaching herd immunity. He is also worried about reported attempts by some health workers to sell vaccination cards to unvaccinated persons.
We have put together a joint task force that will ensure monitoring and accountability to detect and bring offenders to the limelight. We must all understand that the vaccine card racketeering or any other related offense is a crime that can land any convicted person in jail.
And in the course of dealing with the pandemic, we were afforded a rare opportunity of recalibrating the state's healthcare system. We set to work to revamp and equip isolation centers, laboratories, and offices to attend to the peculiarities of the pandemic. The second wave appeared in December 2020. With the second wave of the pandemic, we further strengthened our structures and institutions to better respond to the new challenges.
The citizens' engagement is seen as a significant milestone to get the people of the South Zone actively involved in driving the process of COVID-19 vaccination in Nigeria, as the outcome of this meeting is expected to help key players develop a roadmap for a successful fight against COVID-19. Harry Swanlele, EBS TV News.